We are back at the dental offices of Dr. Norman Bryan and Dr. Anjana Gupta, and we are talking about dental health and a practice that specializes in TMJ and dental medicine. And doctor, you know, during these uncomfortable times for some of us, the economic downturn, especially here in Elkhart, people need to know that putting off proper dental care is not a good idea, is it?
Definitely not. We always try to cut corners where we can. And in dentistry, cutting corners and missing appointments or not taking care of one's oral health obviously has dire consequences, not only because of decay and possibility of periodontal disease, which is certainly a probability when one doesn't get their teeth cleaned routinely, but the other problems that arise with increased stress and so forth. We see people have manifestations in the oral cavity. Obviously, one of the things that we're concerned about here is grinding your teeth and clenching and that sort of thing, headaches, those issues that come from bad economic times as well. But we're also, concerned about things in oral medicine, cancers, infections, these things that people sometimes don't realize that they have. And obviously, neglecting this issue is a major problem. So we would really caution people to not to miss those appointments, to make sure that they're getting their routine checkups. As Benjamin Franklin said, we really, a penny saved is a penny earned, and catching these things early is certainly a real key in saving some money and making sure that one's health is foremost.
And I think even Will Rogers had something to say about that. Like, I think he said nothing is as uncommon as common sense. So common sense would dictate that you come and see Dr. Bryan. And, these segments, folks, really are about educating, inspiring, and informing. And, Doctor, really, that's your mission here, isn't it?
Absolutely. We really want to educate the public on what modern dentistry can do for them, issues that maybe they aren't familiar with, that they don't know or haven't had addressed, that we can certainly help them with. Like I say, my expertise is in sleep problems and TMJ problems, which would mean headaches, neck and shoulder pain, the issues that many times are not addressed and people accommodate. So those are the issues that we really want to let people know that we can help them.
All right, we're going to talk more with Dr. Bryan in just a little bit, but turning now to Dr. Gupta, and good to see you again.
Thank you. Good to see you too, Craig.
Thank you. Last time we spoke with you, we talked about overall care and what a patient would expect maybe when they come to your office for the first time. We're going to talk a little bit about some of the technology here during this segment this week, and especially digital x-rays. Can you talk a little bit about that, Dr. Gupta?
Sure. Dentistry is really one of those exciting fields right now. I mean, there's something new every day.
You have a passion for it, don't you?
I do. I have my entire life. I just think that, taking care of your health and taking care of your oral health is so important. And so, one of the things that we do, as I said earlier, was, having x-rays is important. That shows us things that we can't see with our naked eye. And so one of the newer technologies that we have in our office is a digital panoramic x-ray machine.
Doctor, can you tell us a little bit more about that?
Sure. This is an example of a digital panoramic x-ray, and it's really one of our most valuable diagnostic tools. It shows us an incredible amount of information for being one x-ray, and it really, being that it's digital, has a reduced amount of radiation. I mean, you're really getting very, very little radiation as compared to older types of x-rays with this digital machine. And so it's nice to have one x-ray that shows us so much information. And for example, I can kind of just point out here some of the things that you can see on this x-ray. The first thing you can see here is the vertebrae. And then if you pan over it, we can see the two joints, the temporomandibular joint. You can see the sinuses. You can see, of course, all the teeth. any previous dental work that the patient has had done, current problems, if there's infection at the root of a tooth, we could see it clearly in this x-ray. Often we can see decay in these x-rays. We can often tell if the patient is a clencher or a grinder with this x-ray, depending on the bone. We can see periodontal disease in these x-rays. If there's bone loss, the level of the bone level, we can see that in this type of x-ray. So really it's an x-ray that we like to have on every new patient because it gives us so much information.
That is really key, isn't it? When you come here to your office, every new patient gets this kind of treatment. And then also there's another piece of technology, and we like to talk a lot about it here in the office, and that's the intraoral camera, isn't it?
That's correct. The intraoral camera is one of my favorite tools because it allows the patient to see what I see. You know, so often the doctor says you have a cavity or you need a crown, but why? The patient can't see what we see. The intraoral camera is a small camera, you know, almost like a pen that goes into the mouth and takes pictures of each individual tooth at different angles. So if there's a crack in a tooth or a cavity or a wear pattern that I want to show a patient so that I can better educate them, it's fantastic because it shows up on the screen. They can see what I see. And again, it's something that we do on every new patient so that they can understand what their issues are.
Sure. And I would think understanding really leads to less stress in the chair.
I hope so. I think so. And that's definitely part of the plan. Anything that we can do to make the patient more comfortable and more aware, then we definitely try to do that.
Thank you, Dr. Gupta.
Thank you so much, Craig.
We will be coming right back, and as we do, we'll talk with Dr. Norm Bryan more about what we've just discussed and a whole lot more, so stay tuned.